All right, you're live.
Thanks, Phil. All right. Okay, everyone. Hold on. I have the live version over here to my right, so I can watch the chat. But I turn the sound off, so we should be good. Hello, everyone, and welcome to the webinar hosted today by the Midwest Pediatric Device Consortium, or MPDC. My name is Dwayne Mancini. I'm the CEO of Project MedTech. It's my distinct honor to be moderating the webinar series on behalf of MPDC. For those joining us live on YouTube, we encourage you to actively participate by submitting your questions in the chat at any time. This is intended to be an interactive webinar, very similar to a podcast, and I'll be monitoring that chat for comments and questions as we go throughout with our guest Liz. Today marks our fourth episode of this important webinar series for MPDC. Over the coming months, we'll be presenting a range of topics crucial to the advancements of pediatric medical devices. The dates of our future webinars can be found on MPD's website at pedsinnovation.org, but they will be August 20th and September 17th. Furthermore, we're pleased to announce our in-person showcase scheduled for tomorrow, July 9th in Cleveland, Ohio. We'd love to see anyone who's passionate about pediatric device development join us for this opportunity to connect and collaborate in person. The Midwest Pediatric Device Consortium is an FDA-funded initiative focused on advancing device development across the country, guided by the expertise and dedication of the professionals from leading pediatric medical institutions in the region, Nationwide Children's Hospital in Columbus, Ohio, The Ohio State University in Columbus, Ohio, Cincinnati Children's Hospital in Cincinnati, Ohio, and the Cleveland Clinic in Cleveland, Ohio. Their leadership is instrumental in the MPDC's mission to foster innovation and facilitate the development of much-needed medical devices for our youngest patients. As a valued service, the MPDC facilitates informal discussions with the chief of pediatrics at the Food and Drug Administration, or FDA. This provides a unique and direct avenue to discuss regulatory strategies and the specific considerations pertinent to pediatric medical device application. For those of you actively engaged in pediatric medical device innovation and seeking guidance on regulatory pathways or commercialization strategies, we encourage you to connect with the MPDC through the website at pedsinnovation.org. They're available to discuss your concepts and explore potential paths forward. To stay informed about future webinars, we also invite you to subscribe to MPDC's YouTube channel, which can be found by searching Peds Innovation, and also follow their LinkedIn page. Today, our focus is on a crucial and often challenging aspect of bringing new technology to market. Identifying promising pediatric technology is only one part of the journey. Securing the necessary funding through strategic legislative solutions and state-level initiatives is paramount for those innovations to scale and ultimately reach the children who desperately need them. To help us navigate this complex landscape, we are honored to host an expert in this field, Liz Powell. She brings a wealth of experience and a deep understanding of this space. Liz and I had some great preliminary discussions, and today we aim to explore the critical legislative and strategic approaches needed to address the venture capital shortfall in pediatric technologies. We'll discuss potential policy solutions, how to catalyze investment through state-level initiatives, and actionable strategies to accelerate innovation and ensure these vital technologies reach the children who need them. It's my pleasure to formally introduce our guest today for our discussion, Liz Powell. Liz, thanks for joining us today.
Oh, pleasure to be here.
Yeah, so Liz, maybe just kicking it off with an introduction to yourself, who you are and what you do would be great.
Sure. So I used to work on Capitol Hill. I was the legislative director for a couple different members of Congress, and I staffed health policy. I did a lot of health policy, but I also staffed the Armed Services Committee, so all the military funding streams and programs, and the Small Business Committee, all those SBIRs, SBA loans, those kinds of programs. And then I also staffed the Women's Caucus and the Disabilities Caucus. So a range of issues and experience. And then I used that to start G2G Consulting. And G2G stands for Government to Growth. And I met a lot of entrepreneurs, many in that health innovation, life sciences space, but high-tech innovation overall, who were doing great things, but didn't know how to navigate where to get funding. And so I thought, ooh, I could maybe be that bridge. And so now, 18 years later, we've raised over $500 million in non-dilutive government funding for our clients. We've done lots of regulatory and policy work, State House days, Capitol Hill days, that type of thing. And I would say our common theme across all our clients is that they're all change makers. So whether they're in health innovation, high-tech innovation, or nonprofits, everyone is working to bring innovation and change to society to make it better for all of us. So that's me.
Awesome. Yeah. And actually, we were we were going to do this one live in person here in Cleveland, and then because the MPDC showcase the next day, but you have a Capitol Hill Day tomorrow and I think
Yes.
next week as well. And I was just candidly asking before, like, what is a Capitol Hill Day? But it sounds super interesting that you just, you're organizing for people who are trying to change policy and talk about certain diseases or issues, and getting to meet with people who can potentially influence that. So kudos to you for doing that work. I guess setting the stage with the first question, which is the current climate around DC. So can you kind of give us an overview of what's currently happening in DC that's relevant to pediatric innovation and its funding?
Yeah, there's been a lot going on in DC, especially when it comes to spending money and cutting taxes. So we had a little bill called the Reconciliation Bill that moved its way through Congress and was signed into law as President Trump wanted on July 4th. And what I think is interesting about this bill is that it's going to be shifting healthcare spending, and that will directly impact innovation in this space. So the $1 trillion cut to Medicaid means that there's going to be a shift. Probably premiums will go up for those who are insured. The sort of the cost of innovation and the cost of adoption in the marketplace, that also will be impacted. So sort of like a macro perspective of the impact. The other thing is the provider taxes are being cut back with the new cap. That's how most states pay for Medicaid. So that will be a big shift. On the positive side of driving innovation, though, the legislation, which is now law, has ended what we call the innovation tax. This is something we were lobbying on for 2 years now. So any company, whether it's in that pediatric innovation space or other innovation space, if they received an SBIR, 90% of that total could be taxed. And that was devastating for a lot of companies. Some companies even sent back the money and they said, we don't even want this SBIR if we're now going to have to pay that much in taxes, because of course we didn't budget for it when we submitted the grant. So that has now been eliminated, which is very exciting. I think that will drive innovation. Another exciting change is telehealth has been made permanent for those HSA eligible high deductible health plans. So again, that enables more creativity in that AI health, digital health technology space, which I think is exciting. Another positive, this is more on the medication side of things, but a $5 billion ad was included for pharma for subsequent rare disease medications to make them exempt from Medicare's price negotiation. So that also, I think, will help with innovation. There's also an additional $50 billion fund for rural hospitals, which will definitely impact Ohio. The Medicare physician fee, there's a slight bump, 2.5% bump there, which helps. And then VCs can claim $10 million in income tax-free for investing in certain startup companies. So they're trying to shift some incentivizing around VC investment. So those are a lot of things that are in the reconciliation bill that could be affecting this ecosystem. But in addition to that, they're also working on appropriations for FY26, which starts on October 1 of 2025. So just a few months away. They got behind on that because of this reconciliation bill. But now that that's done, they're shifting back to getting these appropriations bills done. And unfortunately, there are significant cuts in the president's budget. It's a 40% cut to NIH, so that will hurt. I think innovation, that's going to be detrimental. However, that's just a proposal from the president. The House and the Senate are working on their version of that legislation. So hopefully they'll not put in such severe cuts. But there's also shifting around different NIH institutes. And I think of particular interest to you all is the National Institute of Child Health and Human Development. They're now in this budget proposal, they're shrinking the 27 institutes and centers down to 8, and they are lumping in even more areas of focus within NICHD. So that I think that would definitely impact the innovation space in pediatric population. But the NIH Pediatric Research Consortium, that continues, so that's good. The grant program through that continues. So there's more cuts in FDA, but that could be made up for with user fees. They're in user fee negotiations right now. So we'll see how that impacts. But then the priority review voucher for pediatric rare diseases is included in the president's budget proposal. So that is good at 13 million. So not to get too into the weeds, but those are some overview of some things that have been happening that can impact all of you.
Yeah, that's certainly a lot. I think that's one of the things you brought up, maybe right off the rip, was the cuts to Medicaid. I'm guessing that affects children probably at a high amount as well. Can you kind of walk through that a little bit? Now, it sounds like some of these other things you listed maybe offset some of that, but I'd just be curious on how to think about all of that.
Yeah, what's definitely, because Medicaid is for, moms and children, right? So definitely an impact there. But what's interesting is what they did is they have a new cutoff of how they're defining a child. So a child is 13 and younger. So if a child is 14, they will no longer have that. That's the new eligibility line, I guess. They did include, though, I think it was sort of a last minute addition, that they are not requiring that states really enforce it or check on that. But that is the new standard. So if a state wants to be strict on that, they can use that to cut and to save money. And, the states have limited funds, so they have to find some ways to make cuts. So that'll be the impact. And the other thing that's interesting, some 40 states expanded coverage for new moms for that first year postpartum, so that mom and babies are healthy. And but that costs money. So now I think there's a fear that will now be pulled back with less money, and without that provider tax to be able to cover Medicaid. It's just, there's no other way around it. If there's no money to pay for it, you're going to have to pull back on services and coverage. So
Got it. Yeah. Okay. Yeah, no, this is certainly really helpful, and I'm sure we'll kind of dive into some other things that, again, you mentioned the venture piece. I have a question later on, kind of around that. So, one of the things you brought up in our pre-call was the Senator Kennedy's Pediatric Innovation Consortium and its role in addressing this challenge. Can you give us a background on what that is? I mean, when I say Senator Kennedy, there's been a lot of Senator Kennedys. And so I think, yeah, maybe giving us a little bit of a background on what that is might be helpful as well.
Yeah, so it's just really interesting how the whole legislative process has shifted a lot. There was a lot that was added into these annual appropriation bills every year, pilot programs, new funding streams, earmarks. Now they call them community project funding or congressionally directed spending. But back in Edward Kennedy's days, so the senator who passed away in 2009, before he passed away, it was really the year before that, he used that appropriations process to create this pediatric device consortium focused on making sure that we were addressing those gaps and doing what we can to close them so that we could bring innovation forward for children. And so he slipped that into the appropriations bill. And then what's great to see is that over time, Congress has then adopted and authorized this program, which you all obviously are very active in, which I think is really important. And, pediatric medicine, pediatric research has broad support. So at least you've got that, as far as winning over members of Congress to keep that funding coming for that grant program.
Awesome. And real quick, an appropriation bill, can you just talk a little bit more about what that is?
Sure. So every year, Congress has to pass 12 appropriation bills, and they always start in the House. That's actually in our Constitution. They are responding to what the president sends over in the president's budget proposal, but it's really up to the House and the Senate. They really determine those top line numbers for things like HHS, Department of Defense, Department of Commerce, Department of Energy, and then all those different agencies that fall under that. So they are the ones that determine the funding levels. And there's definitely a negotiation back and forth with the White House and with the two chambers when they finalize it. But the way it works is the House crafts the bills first. They vote for them in subcommittee, then full committee, and then it gets sent to the floor. So in each of those sort of gates that it moves through, you can do amendments and alter that. And so then you have that final version that passes the House, and then the Senate is working on their version. They pass each of their 12 bills, and then they come together in what's called a conference committee. And you're supposed to have a conference committee for each of the 12 appropriation bills in the fall. That often doesn't happen, though. There's usually a big omnibus that they just introduce in December. They put everything in it so that members will vote for it. And what's interesting is most recently for the FY 2025, which is the fiscal year we're in right now, they did a continuing resolution at the beginning of this year. It's understandable with the new president and changing parties that it was carried over. But then the final package, what was very rare is that they passed this continuing resolution that just level funds everything, but they didn't give the directions or the details on how to spend that money. It's called a report or explanatory remarks that always accompanies the appropriations bill. They didn't do that this time. So that's why you're seeing the agencies have free range to do what they want. Congress didn't instruct it. So it'll be interesting to see if this time around, what I'm hearing from both Democrats and Republicans is they do not want to do that again. They want more control on where that money goes. But it's just sort of a little interesting factoid for me anyway about how that happened. It's a very rare occurrence that something like that would happen, but that's the appropriations process.
Super interesting. So that
Yeah.
kind of almost controls a little bit of how the president's cabinet would operate, if you will. Yeah, I got it. Okay. Okay. So what are some of the key legislative strategies? And you probably touched on some of them, but maybe, kind of highlighting those at the federal level that could potentially stimulate more investment in pediatric innovation. I think you maybe mentioned how voucher programs might play a role in incentivizing development. I'd just be curious on your thoughts there.
Yeah, so I think that the first thing always is education. Most members of Congress do not have a science background. And so we have to remember that research and science can be very intimidating. So we really want to make it simple. And so I always tell people talk at 8th grade level or lower. And they don't need to know how the technology works. They just need to know, oh, this could cure cancer. That's probably an extreme example, but this could, enable a kid who's lost their limb to have full control, like as if they didn't lose their limb because of AI-powered technology, for example, something like that. That is how we need to talk to folks. And so we need to start with education so that they understand gaps that are out there and that innovation is working so hard to close those gaps, and we can really transform people's lives, which isn't just a wonderful thing, altruistic thing to do, but it also saves money because we waste a lot of money with bad health outcomes. So it's actually in everyone's interest economically as well. So I think education is first and foremost. Second is having a drumbeat and maintaining regular communication with folks. And so whether you come to DC or you do it in Columbus or Cleveland or Cincinnati, wherever you are, that kind of regular interaction and communication is really important. It's important for them to know what you all are doing in this consortium and what each of you are doing at your individual institutions. So that's important. And then lastly, I think being clear about, we're in a climate of cuts right now. So how do the cuts impact you? And it's not that we're going to get back to 100%, but I think we could minimize cuts by doing that education, by doing that relationship development and staying in front of people. So I think that's important. And then finally, for investment. So there's so many creative ways to incentivize investment. And like something in Ohio, we used to have, because I helped a former client with this, they got matching funding. So they succeed in getting an SBIR, and then they got matching funding from the state. There's also the Angel Tax Credit Program. There's just more incentives that don't always have to be research dollars. It could also be tax side of things. But having said that, it's making me think about Governor Kasich did this great program where he actually did invest directly in research. We had another client who secured money for opioid research. And so, that infusion of dollars also can make a big difference. So there's lots of things that can be done, but for your perspective, as far as how you communicate and connect, education at a super simple level, relationship development, staying in touch, I think that is extremely important. And then being clear about the impact of cuts or policies or tax relief, how that could impact pediatric innovation.
Yeah, no, it's super helpful. You brought up the point about, especially at the federal level, but I'm sure it's even at the state level too. But that a lot of the representatives, senators may not be scientists or understand science at a high level. And I mean, I remember back when I was doing my master's degree, trying to explain what I was doing, right, to like even just my parents, right, and trying to make sure they understood like this is what I'm doing, not at a molecule level, but just at a high level. This is what it is, right? And it
Yeah.
gave me good practice for that, and that became important. The other piece that I think would be interesting, and I'd like to hear your take on this, is when we talk to startups and work with them on their commercialization strategy, like what is their value they're bringing to insurance companies, the payers, the hospital systems, the providers, and the patients. It's very easy to talk about the patients. It's very easy to talk about the providers, or at least the physicians and clinicians. It becomes a little more difficult when you have to start making the business case for a hospital. It becomes difficult when you're talking to the payers as well. What do the senators and Congress folks, what are they most concerned with? Is it total cost of care? Like, at what macro level are they looking at this, right? Because for me, it feels like it's a whole nother macro environment that sits on top of an already big one when we're thinking about our commercialization strategy.
Yes. So, I mean, they care about patients, of course, especially constituents that come up with patient stories, but it's all about money. And what's interesting, the way CBO, the Congressional Budget Office, scores any piece of legislation that's been introduced and moving through Congress, they do not do dynamic scoring. So they never mention prevention. And so there's a ton of money that's saved with prevention, but it's never measured when they're scoring these bills. Members of Congress, that is the number one thing. I mean, we are spending too much in our entitlements. And so, there comes a point at which we're going to run out. So that is something that they are very concerned with. So there's been efforts with like the Center for Medicare and Medicaid Innovation Office. They're trying to do pilots, do bundling, trying to come up with sort of creative reimbursement systems that will incentivize doctors to not just run tests, but to actually improve outcomes and have that mindset. But it's a big effort, moving Mount Everest to try and really change our system. But
Mhm.
yeah.
Yeah. Yeah. No, helpful. Are there lessons from other sectors that we can take in the I guess med tech as a whole, but pediatric device perspective as well? Existing legislative models or successes that can be adopted.
Yeah, I think for pediatric device innovation, a good model is a client I'd worked with. This gentleman had a rare cancer, a red head and neck cancer, and was basically told he had a few years to live and that was it. And he could not deal with that. He was only 31. And so he started to reach out to his network. He's like, I know we'll raise money for this. Well, we've got to come up with a cure or some kind of treatment or something. And so he created an organization. He met me. And I said, let's take this to Capitol Hill. And so we sort of had a little army of patients, people touched by cancer, especially rare cancers, to advocate for more dollars to go into rare cancers, because overwhelmingly the dollars were going to the common cancers, because you could argue bigger bang for your buck, right? However, and it's really nice to see, actually, we've seen a whole shift with rare disease. There's much more. People used to think all about blockbuster drugs, and now I think we're seeing a big shift towards rare disease development, and we're seeing a shift towards precision and genetic-based medicine. But in any case, we pounded the pavement. We saw every member of Congress on the committees of jurisdiction. We did House and Senate. We did briefings. We did media stuff, in person, fundraising, like everything you can think of. And in the end, we were able to transform how they were spending dollars. They had a new directive around SBIRs and STTRs to dedicate more dollars towards rare cancer. We got a new funding line created in the defense bill defense appropriations bill for rare cancer, which is still there to this day. And it's been, I think we're going on our 8th year now. And then we were able to include language in a couple other bills. We created an FDA within the Oncology Center of Excellence. Again, there wasn't a focus on rare cancer, so we created an office in there with a little bit of money. And then we put some language in the Health and Human Services funding bill as well. So there's actually an ongoing program within the VA around precision molecular diagnostics that is used before applying a cancer treatment. So we were able to do a lot by doing that advocacy approach. And again, like, people know cancer, of course, but people didn't know about rare cancer. And I feel like with pediatric device innovation, it's a very similar boat where, like, yeah, people know about pediatrics, they know about devices, but are they connecting the dots about those gaps in pediatric device innovation? I don't think so. So I think there's a lot of education that could be done, and there could be a way to designate dollars that way too.
Yeah, really interesting. Um, I guess curious. So a lot of the capital you're referring to is non-dilutive, right? For a
Yeah.
startup company, that's really nice. Talk to me about the time it took from when this person came to you to when this actually got implemented in the government. Because I think a timing, um, uh, understanding how long these things take would be helpful. But again, and to preface this, for a startup company, even if your next answer is 3 years, 4 years, 5 years, whatever it is, you should always think of non-dilutive capital as a parallel path to raising dilutive capital, because that's always the conversation is, well, dilutive capital potentially takes less time to acquire. And that might be right. It also might be wrong. Sometimes it takes a long time to raise dilutive capital, right? And so these other initiatives that are non-dilutive are really important. So I'd just be curious, from a time frame of something like that, how long that might take.
Yeah, that's a really good question. So when we started, it was also just the timing of the year. They were working on the omnibus and they were starting to wrap that up. And so I wanted to work on relationship development, education. I mean, think about, there's so many ways to educate. You have to have a quick one pager. You have to verbally have your, pitch down, and you have to see the right people. And so there's a lot of things that need to come together. So I was focused on that. We had a phenomenal meeting with the Veterans Committee. And he said, you know what? I think I could slip something in the omnibus. I'm like, really? Well, then let's give you some language. So we were successful pretty quickly in getting into the veterans section of the omnibus that very first year within a few months. But the real money was like a whole another year. So it was definitely a good year and a half before we saw dollars being designated. And then it was more like 2.5, 3 years. That's where we really started to see it grow to a $17 million fund for the defense line, for example. So yes, it does take a few years, and you do have to be persistent, maintain a real presence, and show impact. And I will say for rare cancer, we had a general way of communicating, but then we did it tailored. And so we had a very tailored communication, and we did our homework to research the connection between rare cancer and military service. And actually 66% of all cancers experienced by those who have served are rare cancers. So we had a great nexus. We had a whole separate one on pediatric, and because 100% of cancers in children are rare. And so we had a very compelling arguments there. And so I think it could be really valuable to show that. And if any of you are thinking, oh, but we're pediatric innovation, like, how would we fit into the defense bill? There are lines in the defense bill for all kinds of issues that don't really have to do with the military. Lupus, autism, it doesn't have to be like a military injury type of funding line. So you want to be creative there, especially now when the domestic spending is going down and the president's budget is a 23% cut, but the defense spending is a 13% increase. So, you think creatively about where you fit in addition to vouchers and other things. But as far as funding lines, there's a lot of creative ways to do that with some tailored communication.
Yeah. I mean, like, that kind of information, I can remember you talking about that I think with one of our clients, one of our shared clients, and that's maybe where I heard that from the first time. And then I heard you speak at another event where you kind of talked about, hey, the defense spending is a good way, like a good space to look if you're looking for some non-dilutive capital. And it's something that one might not think of, just if they don't have that kind of experience that you do. So moving to some of the state level initiatives, obviously I don't know what else to compare it to, but feel very fortunate to be in Ohio when it comes to early stage health tech innovation. There's some really good programs for really early stage startup companies who have some really innovative products that they can take advantage of all across the state. And that starts at the state level. Now, others may have other opinions on it, but we because we work with a lot of early stage startups, some that don't even necessarily have a company yet, but are thinking about spinning it out. There's some really good programs for me to utilize. How can individual states design initiatives or policies to specifically attract and foster investment in pediatric technologies, but also just create an environment that is inclusive of people potentially taking risks like that?
Yeah, Jobs Ohio does a great job. I actually travel quite a bit, and I'm in other states. I'll have the TV on, and there'll be a commercial, which makes me very
Yeah.
proud. So I think they're really good at going after and attracting to the state. And then you're right, they have good programs for folks who are launching and growing in the state. I think that having a state policy that is so inviting to innovation to companies is huge. Even the apprenticeship program also is great, where they pay for you to bring people onto your team. All those different incentives just create an environment in which people want to take risk. And, they'll up and move from New York to Cleveland, for example, if they see that there's an imaging cluster, so that, they'll try this one company, maybe it doesn't work, but then they can hop to another. So I think having these clusters of innovation is really helpful. And they've worked on doing that, connecting the corridor and all of that, to make those connections. Another initiative that we worked on years ago with Beju Shah with Bioenterprise was the Tech Belt, and connecting Ohio to Pittsburgh, Cleveland area over to Pittsburgh. And we built like 20 different, or helped facilitate 20 different collaborations that had not existed before. So I think anything that just incentivizes collaboration and growth within the state can be hugely helpful, and provide that ecosystem where innovators want to come and they want to take risk. And as far as the investment side, like I talked about, that SBR matching program definitely is a nice one. Angel tax credits, and then just general like investment collaboratives, I think is also can be helpful. Other states that do have much bigger investment community, they do regular convenings and pitching and opportunities to just bring folks together. I think that makes a huge difference as well.
Yeah. Yeah. It's just from my perspective, and I'm not an expert in it. I haven't been in the Cleveland ecosystem as long as a lot of other folks have, or the Ohio ecosystem as a whole. But it seems like if the state is leading initiatives, there also needs to be the private institutions that are coming along there with them and providing that really nice network for folks to collaborate in. And I think at the beginning of this, like there is especially in the Midwest, there is an attractiveness to being in the Midwest as a health tech company. We just named the 4 institutions that are a part of this Midwest Pediatric Device Consortium. no matter what rankings you look at nationwide, and Cincinnati Children's are in the top 10. One of them is number one. It might be Cincy, but they're both very high in terms of pediatric care for patients, and Cleveland Clinic and Ohio State, and there's a lot of other institutions within Ohio. And then like you just mentioned, Pittsburgh's a 2-hour drive from Cleveland, right? Where I grew up in Youngstown, it's an hour drive. And there's a lot of good institutions there. And you move into Michigan and Indiana, and Kentucky has a bunch of initiatives going on now as well. Like, these are all 3-hour drives in some cases. And so it's just really interesting to kind of see that. Beyond direct legislation, what are some actionable strategies various stakeholders, like think researchers, clinicians, investors, parents, what can they do to help accelerate pediatric innovation, specifically as it relates to device? And that's the whole point of this series. We talk about my background's in small molecule design and synthetic chemistry, but for those ones, sometimes it's literally as easy as scaling down the dosage for a patient, right? With devices, it's not that easy, right? And so it is really important that there is funding for companies to access in order to make devices smaller, or deal with the fact that, a patient can go from, 30 inches to 50 inches in a 2-year time frame, and how does that affect the anatomy? So there's a lot of logistical things. How do we, just influence that kind of actionable strategies?
Well, don't underrate the cool factor. So I actually did a congressional briefing the beginning of this week. And the way we explained it is, what is Luke Skywalker, who had his arm in with anyone who loses their limb today or in the near future? It's AI-powered neural signaling technology. And so that's how we got people's attention. So I think it's important to frame this as, look at the cool technology, the cool devices that are coming out of research and innovation for the pediatric population. I think showing is going to be super impactful. So you almost need like a marketing campaign around pediatric device innovation specifically. I think that those visuals on that storytelling is super important. And then I think doing these convenings where we're bringing folks together from different parts of the ecosystem. So you have the investors, you have the researchers, the C-suite, the entrepreneurs, you have the students who are getting their PhDs, you have patients, you have family members, like having all these different aspects of the ecosystem come together regularly to address pediatric device innovation gaps and opportunities, I think also would be powerful. And getting the state at the governor's level to be engaged in that, then you get media coverage. And so, sometimes, not legislation, but just the podium can do a lot to drive interest, excitement, and innovation.
Yeah, you brought up storytelling. This is super interesting because we coach so many of our startups on their storytelling ability, whether it be for raising capital from angels, family offices, venture capital groups, corporate venture, whatever it is, whether it be talking to clinicians who are going to use the product, whether it's talking to a hospital system to adopt the technology. We always talk about storytelling and to hit on the things that they care about. And just from hosting this webinar series, this is the 4th one, we just had one on health economics. And it really didn't dawn on me until that one, where we talked about what are some of the big drivers to talk about when you're talking about how this device could potentially contribute, like what was the economic impact of it. And some of the points they brought up were, they talked about what happens when, a kid gets really sick, and now that parent gets pulled out of the workforce, and what's the economic impact there, and
Yeah.
what's the economic impact over time to that patient. Now for health, for various insurance companies, it's sometimes difficult because that patient won't be with that same insurance provider or payer throughout the duration. But the potential impact, if there is a cure, or in quotations, is massive, because it's not just affecting the patient, but it's affecting the potential parents and the family members and the support system. And I never thought of it that way, but it feels like, for me, to me, that would be an important piece for what we're talking about today, is that potential impact. I mean, is that kind of what you're talking about when you think about that storytelling?
Yes, 100%. And think about the economic impact, because now the parents, their ability to work at their full capacity and to be fully productive is now impacted. So now the company isn't making the revenue that it used to make. I mean, the people around that are managed by that team member, communities. I mean, so many communities are held up by parents that, organize activities that are key for children to grow. So there is a huge ripple effect when someone is sick and when someone can't get the care that they need. So I think it can be very compelling.
Hmm. All right. I had a question here about role of advocacy, but I feel like we've addressed some of those and even some of your experience there. So for early stage pediatric innovations, you've given some tips, but how can they best position themselves to attract the limited capital that is currently available? Like there's definitely pockets of money, right? But there's a lot of people probably fighting over that. So how do you position yourself to potentially win some of those dollars?
So, my expertise is more in the government side. So, you've got defense, I talked about, we've got NIH, ARPA-H. Those would be the main ones, NSF probably. And so what I think is important is to study the opportunities that they are putting out there, but then also develop relationships. So I go and talk to program managers regularly to find out what's coming down the pike, things that are not listed on any website, right? It's like insights and what they're looking for. And then there's certain funding streams with DoD that are broad agency announcements, or certain pathways that it's not going to be a grant listed on a website. It's going to be, you have to develop that relationship with the program manager. You have to align with what their priorities are. So you want to take that time to figure out what are they doing generally, and then how can I get to know program managers within that can give me tips on things that I should be emphasizing, and maybe opportunities that aren't worth pursuing. I know that's not great news, but isn't it better to get dumped on the first date than at the altar, right? So it's way better to find out early that it's not a fit. So for example, we go to conferences, like there's a huge military medical conference that's coming up the first week of August. It's in Kissimmee, Florida, which is next to Orlando, in August. So it'll be very hot, but it is a phenomenal networking opportunity to meet with different program managers, directors, the leadership within DoD and the VA. And it's all about military medical innovation. So that's something I really recommend. All the military it's not just the person in service, it's their whole family that is covered by TRICARE. So they are always looking for ways to address the full family and with medical innovation. And then BARDA is another one, which is the Biomedical Advanced Research Development Authority. They do a conference every November, and that is in response to mass casualty situations. So whether it is like a bomb or something like that, or influenza or some other, COVID. So something like that. So there could be different pediatric device innovation opportunities there too. So I would go physically and meet with people in addition to just looking at, what's coming out in the grant notices.
Yeah, super helpful. Awesome. And then last question, which is critical next steps. So looking ahead, what are the most critical steps we need to take as a community in the next 1 to 3 years to truly bridge this pediatric gap?
Yeah. So it's going to be similar to what I said earlier. So I think education, storytelling, I think that's going to be really important. developing those relationships, explaining the impact of decisions in Washington, in the State House, on pediatric innovation, and how that impacts patients. Because, little kids suffering, that is definitely going to pull at people's heartstrings. So that can be very compelling. And then, working to get this, there's the rare pediatric disease priority review voucher program that expired actually in December. So that still needs to be reauthorized. So that would be more of a specific legislative request. The tax incentives for investment, I think talking about that. It's just really important to stay engaged. It's a lot of repeat and it takes time. It's not going to be one and done, but those would be my final tips or advice for this group.
Awesome. Liz, I'll ask one more question, and it's maybe just around timing. How much does timing have to do with a lot of this? And I guess really when I think about timing, I'm thinking about, and maybe there's other things I'm not thinking about. The question was coming from was, okay, we had a new president start seven months ago. We have in 18 months, right, a pretty big primary election.
Yeah.
Right. And so is it like, hey, once we get within a 6-month period of a major election, don't expect things to move? Is that the time to engage? Like, because you told that one story about how you just kind of snuck right into some verbiage. So it's like, I just be curious of like, as people are thinking about this, when is there like a time where you're like, hey, don't bother, just save your time. Let's start in a few months, or what does that look like?
Yes. I would say the best time is really summer, fall, because you want to take your time to have your strategy, figure out your messaging, what are your goals, what are you trying to get, and then start to develop those relationships. So that takes time. And then the fiscal like appropriations process I described, that budget process happens every year. And that's the train that's always moving. So it's one you want to hop onto. Also, the grants that are coming out are often held up until they finish that funding bill. So for many reasons, I really think summer, fall is ideal. But any time of year, there are grants coming out generally. I think this has been a very funky year, obviously, with the cuts and the changes. But normally, any time of year, there are grants coming out. But I would say ideally summer, fall.
Awesome. Yeah, Liz, this has been great. I think it's an area that it's venture capital and raising capital in general from dilutive sources is difficult, right? Like it's sometimes a black box. It's like I don't know what the best strategy is, but also there's not 24/7 media coverage on that topic, right? And what makes non-dilutive capital so interesting is that people have strong opinions on these different topics that we touched on today, and they don't have anywhere close to the knowledge of what's really going on. And so it's just such an interesting space and such an interesting topic. And so I really appreciate you educating us on so much today. I know I learned a ton. The challenges are clear, but there's also pathways and resources available to support innovation. To our audience, thank you for your engagement. A reminder to visit pedsinnovation.org for more information on the MPDC, their services, and future events, including the in-person showcase tomorrow, July 9th in Cleveland. And please subscribe to the YouTube channel, Peds Innovation, and follow MPDC on LinkedIn. This concludes our webinar, and thank you all for joining us. And thanks, Liz, for sharing your insights.
Thank you.
Yep. Bye.
Bye.